is what now?
This is what now? You know, the coronavirus pandemic has a lot of us wondering, what can I do to protect myself? Now, social distancing, of course, is one very important way, but what can we do for our bodies? With us now on the phone is Dr. Eldred Taylor. He's a holistic medicine practitioner out of Atlanta, Georgia. He, again, joins us now on the phone. Dr. Taylor, thanks so much for taking the time.
Oh, thank you so much for having me on your radio show.
So let me ask you, it appears that the most at risk are people with underlying health conditions, right? So what steps can they and really any one of us take to stay healthy during this crisis?
Yeah, you know,
and beyond.
I think the most important thing is not to panic. I want people to not focus so much on what you see on CNN about the death rate and all those things. If you look like Rudy Gobert, the NBA player that tested positive and actually shut down the NBA, he, doesn't have any real symptoms. He's doing well. So most people are going to do fine. But, he is the epitome of health. He's a professional athlete. So it seems obvious that the healthier you are, the more likely you are going to either not get infected, or if you do, you're going to have minimal symptoms. So the first thing you should do is not panic. That's why I don't want you to look at too much of the news or the bad news, is that because stress will decrease your immune system response. And we all know that if we work, long hours for a long time, or you don't get enough sleep, you're more susceptible to having some type of cold or infection. So first of all, I don't want people to panic. The other thing, to build your immune system, one thing you can do, and this is something you would have to do in the long term, it's not a quick fix, it's like probiotics. Because 70% of your immune system is in your gut, and the way to keep your gut healthy is, one, not to eat things that can damage your gut, like processed foods and things like that. But the other one is to take probiotics. Good bacteria helps to kind of control the immune system so it doesn't go overboard, because that's what happens in this overwhelming infection. Vitamin D is also very important to help maintain a healthy immune system. And so when you go to the doctor, it's good to have your vitamin D level checked, and it should be somewhere between 50 and 70 and not above 100. So between 50 and 100 is a good vitamin D level. And the other thing you can do in the short term is to take vitamin C. Vitamin C has been shown to be an antiviral, and also it does something called, it helps to dampen something called a cytokine storm. And cytokines are released when the body is inflamed, and it can cause all types of problems. And we can talk about that. That's really what's going on when these people are on ventilators in the ICU.
Yeah, I was going to ask you that question, Doctor. This is something that you're seeing playing out in China, right? That China is now showing signs of progress in handling coronavirus. Talk to us about that. What, if any, lessons you're learning from that experience? And I know we talked offline and you were referring to vitamin C.
Yeah, well, if you look, you can actually look it up on Google. Look at the Shanghai government and their response to the coronavirus. And the Shanghai government recommended that these hospitals treat patients with IV vitamin C. Now, we're talking about 24 grams of IV vitamin C every day for 5 days. And where they built 14 hospitals to hospitalize these patients, they're actually shutting those hospitals down because they began using IV vitamin C. So if you look at the science, there's a lot of studies that show the efficacy of vitamin C, and there's some show that there is limited efficacy. But if you look at those studies, the ones that don't show any effect from vitamin C are studies that didn't use an adequate amount. So where someone is taking 1,000 or 2,000 milligrams by mouth, the body only absorbs about 20 to 40% of that. And so if you're taking 1,000 milligrams, you might be actually getting 400 to 500 milligrams. But we're talking about 24 grams or 24,000 milligrams given IV. It has been shown to be an antiviral, and it decreases that cytokine storm that inflames the small sacs of the lungs where you can't transfer oxygen into the blood. And that's what's causing these people to be on ventilators who have serious infections. So that's a lesson to be learned. And I would encourage people to, if they have a loved one who's in that situation, that is something I would encourage them to ask their physician to give that a try. There's actually a law that says if there is a non-toxic, inexpensive treatment that can be given to a patient, that the patient shouldn't be denied that treatment. And vitamin C is one of those. It's inexpensive and it's non-toxic. And so that might be the one thing that I would say that anyone who is in that dire situation, a family member, I would encourage a family member to advocate that being done.
And you can't get too much vitamin C, right, Dr. Taylor? I can knock back a couple of those emergencies per day, and that's not an issue about going overboard, right?
No, the only theoretical risk of vitamin C is that it can cause kidney stones. That's theoretical. It really hasn't been proven to be a cause and effect. And if you're talking about not being able to breathe or having a kidney stone, I would take that risk.
All right.
Doctor, just let me ask you one question about the death rate, because, we're seeing these numbers every day. These numbers are scary. How frightened should we be by these numbers that we're seeing come in and day out now?
Well, if you look at the death rate, so that would mean the number of deaths divided by the number of people who have the coronavirus. And because we have such limited testing, we don't know how many people are affected. I just did a quick calculation I saw on CNN that the number of cases now that we're testing more is 11,000. Now, from what I saw, the last number I saw that we had like around 200 deaths or maybe 300 deaths. So if you divide 300 by 11,000, I just did it, you've got 1.8% or 2%. And that's been pretty much the death rate that they thought they were going to get. But you've got to think there's 300 million people in the United States. We have a limited number of tests. So really we don't have a true denominator. So the death rate could be much, much less than that. And I'm hoping with the social distancing and all the things that we're doing, I hope that we can keep that death rate, below 2%. So it's very, when you think about those 200, 300, 400 deaths, it is scary. No doubt about it. It's scary, but you got to look at it on the big picture. There's 300 million people. This is something we should definitely take seriously, but we don't want to panic about it. Panic never allows you to make good decisions. So
yeah, and as you said, let's all start by de-stressing, taking a collective deep breath right now. So here we go. Right? Feels good. Dr. Eldred Taylor, you are a holistic medicine practitioner out of Atlanta, Georgia. Thank you so much for taking the time.
Oh, thank you so much for having me.